Hello everyone, what's up with you? This is Doctor.Sreeraj with you. In this video, we're going to talk about the recent ban on the generic medicine Ranitidine. It's not something new that the modern medicine bans something after finding that it creates serious health hazards. This happened many times in the past with many popular medications. But when it comes to Ranitidine, which is one of the favorites of doctors and patients for decades, it could create a lot of panic. If this is the plight of a drug which is on the World Health Organization's list of essential medicines, which is a list of the safest and most effective medicines needed in the health system, how can we trust the rest of the medicine? But there is nothing you can do about it other than detoxify yourself and stop having further abuse. Well, ranitidine is an H2 histamine receptor antagonist that works by blocking histamine and eventually decreasing the amount of acid released by the cells of the stomach. It is commonly used to treat and prevent acid reflux disease, hyperacidity, stomach ulcers, and other gastric troubles. More than to treat acidity, it is now widely prescribed to prevent the adverse effect of other drugs like painkillers, antibiotics, steroids, and other medications. And that's what makes a lot of confusions among the regular users. And this video is about the adverse effect of any preventive medicine like ranitidine in general and their complications. Any medicine that is known or labeled as preventive medicine becomes the favorite of the patients. They think it's totally out of risk to take it anytime whenever the similar symptoms arise again. So it becomes an over-the-counter drug. In India, even pharmacists recommend these pills to their consumers. Once an individual is cured, very happily he recommends it to his friends and relatives and so on. And it becomes an OTC favorite. Although ranitidine is a prescription drug, it is mostly continued by the patients later on as an OTC drug, almost lifelong. I don't know how and what impurities in ranitidine creates the cancer. It may even get rid of guilt later. But I'm here to talk about the other complications of such preventive medicines in general. It need not be necessarily always to be found as carcinogenic to use a drug wisely, right? Well, one of the major issues I found with these kind of drugs is the dependency. Once you are a regular user for more than 6 months, for example, you get kind of dependent on it. And you cannot survive without that drug anymore. I tried stopping antacids like ranitidine, omeprazole, pantoprazole, etc. in many patients, but the withdrawal symptoms were quite bad. It takes a few weeks to few months to stabilize the patient by weaning those medications. Another issue I've found is it conceals the actual symptoms and ailments from you. Whenever I take a history, I ask my patients about their digestion, like whether there is any gastric issues or bloating, etc. Then they totally deny that question by making a statement that they are already on antacids on daily basis and they don't want me to do anything for that purpose anymore. Understanding the minute symptoms in a digestive system is super important in any medical system to make a better diagnosis. So by masking those symptoms with medications will lead to long-term complications, including the stomach cancer. Well, I'm not trying to paint Ayurveda totally white. You can watch my video about the Ayurvedic medicines that contains heavy metals and toxins in my own channel. But our herbal medicines just don't relieve the symptoms, but also improve the digestion, absorption, and metabolism. Any lab-made chemical drug is poisonous in one way or other, if taken overdose or without proper directions. Even paracetamol is hepatotoxic if taken in larger doses or if frequently taken. You can even be overdosed with vitamin tablets. Anything that acts so fast in your body, so swift in your body, has a possibility of having bigger side effects as well. For example, the drug warfarin, the popular anticoagulant drug, which is known as a preventive drug of choice in many conditions. It was first invented as a potent rat poison to kill the rodents. But then they found that the rats were mostly killed by internal bleeding. Then they had human trials and found out that the anti-blood clotting properties of warfarin in precise doses. It is now used to treat conditions like arterial fibrillation, deep vein thrombosis, etc. and is given as a preventive medicine for stroke and heart attacks. It is such a weird drug that you need to closely monitor the blood clotting time every other day to decide the actual daily dose of that medicine. If the dose goes higher, you will have chances of internal bleeding or hemorrhagic stroke. And if the dose is less, you tend to have ischemic or embolic stroke with blood clots. And even the leafy vegetables you take on a daily basis can affect the action of that drug in the body. And God knows why do we take such a risky drug and not replacing it with any other one. By the way, still continue to be sold in two formats in the market. One is to save human lives and the other to kill the rats. Well, let's go back to our topic of the preventive medications. These days, it's so common that once you get a mild chest pain or slight variations in the ECG, you'll be prescribed with a bunch of unwanted preventive medications unnecessarily. You'll be given like 1 or 2 antihypertensive pills, whether or not you have high blood pressure. You'll be given 1 or 2 pills for high blood sugar, even if you are not diabetic. Another thing given is a few statin tablets for high cholesterol, even if your cholesterol levels are normal. You will also be given with a baby aspirin pill to make your blood thinner. Do you really need all these medications or only a few of them? Nobody is there to ask the doctors. And the doctor doesn't have time to listen to your stupid questions. He has another 200 patients in the corridor with their token waiting for their turn. It's not just in India. Even in the Middle East, Arabs eat medicines like food. I don't tell any of my patients to stop them, by the way. If you do, you will be responsible for the rest of their life. I asked one of my European patients if he is taking any pills for cholesterol. He said he used to have it, but his doctor asked him to stop it once they found out that the concept of cholesterol itself was wrong. Yes, the whole scary stories of high cholesterol leading to heart attack was just a scam. Can you believe that all those pills you popped in was just to give you side effects and not to prevent your heart disease? It's proved that statins can affect the liver functions very badly. But still, it's prescribed left, right and center in India. Nobody can stop it but you. Before concluding, I would like to give you an example of a prescription which is given to a patient in Kerala by a super popular doctor to prevent heart attack and to avoid a coronary artery bypass surgery. Well, this patient came to me years back with liver cancer and I saw his ongoing prescription medications at that time. I was astonished to see them. He was taking it for more than 5 years and ended up in having hepatocarcinoma. I didn't prescribe him any more medications as he was already taking more medicines than food in a day. Can you imagine that this is a tapered list of medicine at that time? Initially it was 90 plus pills in a day with strict diet controls and exercises for years together. Then they reduced it to 70 plus pills and then so on. I swear it's a true story and that patient didn't show up again. Well, I'm no one to judge this doctor's prescription. He is licensed to scribble anything in a prescription pad, but it is you, the people, who should think twice before swallowing them blindly. You should take care of yourself. Alright guys, that wraps up another one. Hopefully you enjoyed this video and maybe you've got some good information out of this one. If you did, feel free to smash that thumbs up button. That helps us a lot. If you're not a subscriber, please consider doing it. We would like to have you on board. I'll see you in my next video. Until then, take care and stay safe. This is Dr. Sreeraj leaving for the moment. Bye-bye.